The CDC has decided to extend its review of the Johnson & Johnson vaccine following an emergency meeting yesterday. All 50 states, Washington, D.C., and Puerto Rico temporarily paused administering these shots. Despite the setback, immunization rates are rising in the U.S. Nearly 30% of American adults are fully vaccinated, and more than 250 million doses have been delivered. Laura Podesta is following the very latest. Laura, even though officials weren't able to come to a conclusion, what did we learn from this crucial meeting?
Good morning, Emery. So experts at the meeting yesterday said they were considering a whole range of options as far as what to do with the Johnson & Johnson vaccine, including recommending it to only specific groups of people or potentially abandoning it altogether. But ultimately, at the meeting yesterday, they decided they don't have enough data on the 6 cases or any other potential cases to make a decision.
An emergency meeting at the CDC to discuss the extremely rare blood clots possibly associated with the Johnson & Johnson vaccine ended without a decision on when the shots can be given again.
I just don't feel that was enough information to make an evidence-based decision.
We're in a situation where not making a decision is tantamount to making a decision. The most at risk will remain at risk.
That inaction will likely extend the pause of the single-dose vaccine for at least another week. And even though the Pfizer and Moderna vaccine should cover most of the shortfall, mobile vaccination buses, like this one in Colorado, found it easier to deliver the J&J vaccine to rural communities.
It's a one-shot vaccination. So then we can put our efforts into going to more places rather than having to come back around and do a second vaccination.
Out of more than 7 million doses already administered, 6 women came down with a rare blood clotting disorder. One of those women died.
Right now, we believe these events to be extremely rare, but we are also not yet certain. We have heard about all possible cases.
Health experts are now concerned that the J&J fallout will make more people hesitant to get vaccinated. A national poll from Monmouth University says about 1 in 5 Americans are unwilling to get any shot.
And it's also worth noting, Anne-Marie, that doctors used the blood thinner heparin to treat 4 out of the 6 women who were found to have these blood clots. But doctors have now determined that that kind of drug is dangerous for the kind of clotting that has been found in the Johnson & Johnson recipients.
Wow. So we know it's only 6 women who have been affected this way out of millions and millions of doses, but still it's a significant health concern. So what do we know about the women who suffered these blood clots?
We're learning a lot. We're learning that all of them had the symptom of severe headaches. 3 of them had obesity as a pre-existing condition. 1 of them was taking estrogen and progesterone, and at least 2 of them have been released from the hospital at this time, Anne-Marie.
All right, Laura Podesta, thank you.